So let me summarize the differences that we found between ADHD and other outpatient disorders. ADHD is more severe in terms of its symptoms and the impact of those symptoms. ADHD is a more chronic disorder and unremitting. Most other outpatient disorders are episodic, including anxiety disorders, depression, and so on. We found that ADHD produced more severe impairments. Whatever domain you looked at, the adults with ADHD were more impaired in that domain than were adults with other disorders. There were more impairments in the adults with ADHD. If you counted up the number of different domains that ADHD interfered with, it was more than in any other group of our outpatient control group. The most adverse effects, as I've already said, were in education, followed by work, followed by social relationships and finances in adult life. Some of the outcomes, as we've explained, are life-threatening. Others are going to have an impact overall on the health and well-being of these individuals. We did find that adults with ADHD turned out to be more responsive to our treatments than were these other disorders. So that adult ADHD is actually a more treatable disorder than our anxiety disorders and depression. But we also found that having adult ADHD and not treating it is very costly to the patient, to their families, to society that has to pick up the costs, these indirect costs. So I didn't go through all of this to depress you. I went through all of this to impress you that this is a very serious disorder. This is not some trivial little fly-by-night disorder. And also to emphasize something that I don't think is emphasized enough, especially by other advocates, ADHD is no gift. There is no evidence in any research on any of hundreds of measures that we have taken that show that ADHD predisposes to anything positive in human life. Now let's be clear. ADHD is but a small set of the hundreds of psychological abilities that people will have. And many people may be gifted and talented in various aspects of these other human abilities, but never attribute that giftedness or that success to the ADHD itself. There is a profound tendency in the US right now for advocates to roll everything about a patient under the tent of their ADHD and to use it to account for everything. So that Michael Phelps won 8 gold medal Olympics because he was ADHD. And the owner of JetBlue is a successful entrepreneur running an airline because of his ADHD. And Howie Mandel on Deal or No Deal is a successful comic turned game show host because of his ADHD. And Ty Pennington on Extreme Home Makeover is very successful at destroying and rebuilding houses for other charitable purposes because of his ADHD. None of this is true at all. These people are successful because they have other attributes in which they are gifted, but in no way does ADHD predispose to any of the things that I have mentioned. If so, we would have seen it. So I want people to understand that while people may be gifted and talented and successful in spite of their ADHD, it is not because of their ADHD. The ADHD itself may in fact make you less effective than what other people who have equally talented areas in those human abilities. We don't know. Nobody's done that comparison. But it's going to be very hard for society to take you all seriously if you continue to trumpet this disorder as a gift. There is no way that we can go to Ottawa and walk the halls of Parliament arguing for accommodations, entitlements, funding of ADHD medications on the one hand, while rah-rah cheering ADHD as this wonderful giftedness that we have and you don't. They are antithetical to each other, and it doesn't work, and it's a lie. So let's stop deceiving people about this. This is a real disorder. It's a very serious disorder, but it doesn't mean you may not be talented in many other areas of life, and that you can use those areas of talent to compensate for the disadvantages that ADHD may be producing. But success is not attributable to ADHD, not in any of the hundreds of studies that have been done to date. So I'm asking for clarification on this issue. I'm not saying that people can't succeed with this disorder, but it won't be their ADHD that caused that. So what do we need to do? The first thing that we need to do to address these issues is to make sure that adults with ADHD are extraordinarily well informed about the nature of their disorder and the risks that go with it. And so that means reading, learning, going on the internet, and making yourself an expert on the disorder, its causes, its impairments. You've done that merely by attending this weekend you've gotten a lot of information about these issues. But continue to make yourself an expert so that you stay abreast of the developments in this field. And also of the things that do and don't work. We know things that don't work. We know that dietary manipulation is not very useful. We know that getting your skull massaged by a chiropractor is not useful, that acupuncture is not useful for this disorder at this time, and other such things like sensory integration training and so on. There are many treatments that we can use, and we're going through them in just a moment, but there are things that you should steer clear of, magnetic mattresses being among them. You should adopt a chronic disability perspective for the disorder, very much like diabetes, as I argued this morning, the reasons being very obvious. This is a neurobiological disorder. Now, one of the first things that Kevin Murphy and I have learned to do with our adults is, after going over all of this can be rather depressing, can it not? And so the next thing we do is to try to instill hope in our patients as well. And we do so by explaining to you that you have the most treatable disorder in all of psychiatry. There is no disorder in the mental health profession that has as many treatments, that normalize as many people, that have the highest percentage of responders to treatment, and produces the greatest improvement in symptomatic relief as this disorder. Not one. Not bipolar, not depression, not anxiety, not schizophrenia, not mood disorders, none. Those other disorders wish they had the available treatments that we have in North America for managing this disorder. Our problem is not effective treatment. Our problem is public awareness of this disorder. When only 1 in 10 people get access to care and get treated for the most treatable disorder in psychiatry, that's the problem. But the treatments we have work, and they work for most people, and they work very well. That's not to say that they solve all the problems. So one of the first things that we instill in our people is you need to get treatment because you have a very treatable, manageable disorder. Now, we also find when we meet with our adults with ADHD that this diagnosis and this history of impairments usually brings with it a mild grief response. Sometimes it's not so mild, by the way. Sometimes the anger and the grieving and the depression are quite extreme and require separate counseling sessions in their own right. We have had adults with ADHD become extraordinarily angry about how could earlier professionals have missed this diagnosis, and the regrets they have about the failures that are now irreparable. The marriages lost, the college degree never attained, the friendships that were lost, the accidents that they had, maybe the injuries. You can't make up for that. Even though you may get diagnosed at 35 or 40 years of age, there's 40 years there of irreparable harms that have mounted up. So it's no surprise that some of our adults are angry or depressed about not having been treated earlier when it might have made a difference in changing their life course. So we will spend some time with these adults, speaking with them about these feelings and helping them unearth them and cope with them, but moving them on to the end stage of a grief reaction, which is acceptance. So that's where we want you, because you won't engage treatment if you haven't aggrieved and accepted your disorder. Now, we also, as I've said, want our adults with ADHD to understand what is attributable to ADHD and what may be due to other disorders. Over 80% of adults with ADHD have a second disorder, and over 55% have a third disorder. So the most common pattern is for adults with ADHD to have 3 disorders. And all of them are going to need to be treated, because treating the ADHD won't get rid of the other 2. By the way, the other 2 that are most common, apart from the learning disabilities that had to do with school, are anxiety and dysthymia, which is a mild form of major depression. The risk for depression is there, but it's really more anxiety disorders. In fact, we were the first longitudinal study to show that the longer your ADHD went untreated, the greater the likelihood it was going to link up with an anxiety disorder over time. We also want the partners, the spouses, the family members of adults with ADHD to learn about the disorder, to understand its neurobiological underpinning, in order to do, if only one thing, and that is to remove ADHD from the realm of moral judgment. Because that is how most relatives and family members view this undiagnosed patient, as a character flaw, as a personality deficit, and as a moral failing. You could be different if you wanted to be. It's merely a choice that you're making. And we need relatives and partners and spouses to understand this is no choice. this is this disorder. And in doing so, we hope to pull it under the realm of the medical and mental health sciences, and therefore under the realm of compassion and a willingness to assist the adult with ADHD, as opposed to the realm of judgment